With love for our nation and loyalty for our fellow citizens, we will safeguard our families, care for our neighbors, heal the sick, protect our workers, and build the future for a country that is the greatest country anywhere in the world, and we're only going to get greater. Thank you very much. Mike Pence, please.
Thank you, Mr. President. White House Coronavirus Task Force met today, and despite the fact that there have been more than 843,000 Americans who contracted the coronavirus, and we grieve the loss of more than 47,000 of our countrymen. According to Dr. Birx and her team, we continue to see encouraging signs because the American people have been putting into practice the guidance that's been issued by the President and this task force, and they've been taking to heart the guidance of state and local officials. And Mr. President, as we learned today, we are continuing to see declines in all the major metro areas around the country that have been most impacted. Numbers remain low and steady on the West Coast, in Washington State and in California. The New York metro area, New Jersey, Connecticut, all appear to be past their peak. And as our scientists may reflect in a few moments, we also are seeing the positive rate going down, which is actually even as encouraging as the declining cases. The Detroit metro area appears to be past its peak. The Seattle metro area, as I mentioned, remains stable. New Orleans metro area is the most stable of all the large metro outbreaks. We also are continuing to see stabilization and even declines in Houston and Atlanta and Nashville and Baltimore and Indianapolis and elsewhere. This is a tribute to the American people, to the fact that the American people have taken to heart the guidelines, the social distancing, the personal hygiene, the recommendation that you use the drive-through at a restaurant rather than going in a restaurant and avoiding groups of more than 10. On the President's behalf, on behalf of our entire White House Coronavirus Task Force, we just want to urge all of the American people to continue onward. We all want to reopen America, and we want to reopen our states and our communities as soon as it is safe and responsible to do so. But I want to say to my countrymen, the fastest way to reopen America is to continue to do what you've been doing. It's the fastest way, as President Trump has said many times, to get our country working again is to put the coronavirus in the past. And we are on our way to doing just that. You know, for early on, the President called forth not only the full power of the federal government, but he called forth the full weight of the American economy. And I had the privilege yesterday to travel to Madison, Wisconsin, and see American industry and American workers at their very best. And I want to thank the GE healthcare team in Wisconsin, as well as the union machinists that I spent time with all day yesterday. It was extraordinary. And Mr. President, earlier this month, you used the Defense Production Act to ensure that supplies could flow to GE and General Motors and Ford and other companies that were prepared to repurpose manufacturing lines and hire new workers to construct ventilators. And at this particular plant, they literally have, the union sat down, the machinist union sat down, and in less than 1 week negotiated a new contract with GE Healthcare that allowed them to begin to bring in workers from around the country. They doubled their work line in 1 week. They're about to triple it. They've been going 24 hours a day, 3 shifts, 7 days a week. And the President promised that
That's
by
amazing.
harnessing the power of the American economy, we would have 100,000 ventilators in 100 days. But thanks to the ingenuity and the hard-working Americans that I was with yesterday and other companies, we're actually going to have 110,000 ventilators in 100 days. They were all wearing T-shirts, Mr. President. I brought one back for you that simply read, "Union Machinists Save Lives." And to that great team at GE Healthcare, I want to just say all of America is proud of you and grateful for you. We're also grateful to all of our healthcare workers at every level and all the work that they're doing. And we're proud that our National Guard and our American military are at their side. As our task force learned today, more than 31,000 National Guard have been stood up around the country. And the President, in the last day, extended what's called Title 32 authorizations for all National Guard personnel through May 31. So we're going to continue to partner with states as the National Guard plays a vital role in testing and in cleaning nursing homes and in standing up states' response. Military personnel, Mr. President, we have more than 5,500 active duty military personnel, including, as of yesterday, 964 medical professionals in the uniform of the United States working in 17 hospitals in 7 states around the country. We're also very proud of our team at the VA. The VA has addressed its capacity issues. It's not seen cases among the veterans in its facilities increase, so they're deploying teams to focus on nursing homes. In Massachusetts, the VA personnel have disinfected 2 different nursing homes. In New Jersey, they literally taken over 2 state nursing homes and deployed 90 doctors and nurses. And in Florida, we're sending 16 teams to assist in nursing home operations. As the President also mentioned, in addition to what I saw yesterday in Madison, Wisconsin, we continue to build our strategic national stockpile. It's growing again with ventilators on nearly 11,000 in supply. 901 new ventilators will be added, transitioned in the near term, and every American, I think, can be confident that should the need arise for your family member facing serious consequences from the coronavirus to need that equipment to help them breathe, that equipment will be there. As we said yesterday in Wisconsin, and you said, Mr. President, I think it should be a great source of comfort to every American that no American who has required a ventilator in the United States has been denied a ventilator. And that's a testament to our healthcare workers, a testament to every American putting mitigation principles into practice, and it's a testament to all these great companies. Speaking of great companies, American businesses are stepping up. It was on April 1st that I traveled to a Walmart distribution center, and the President reached out to the President and CEO of Walmart to ask Walmart to get in the gowns business. And Mr. President, I'm glad to report to you that we heard today at the task force that Walmart is producing 8.4 million gowns, and they will be delivered into our commercial supply to healthcare facilities around the country by the end of June. They're hardly alone. Honda is producing 500,000 face shields. New Balance is making 100,000 masks a week. In a very real sense, the American people have stepped up to make the sacrifices and endure the hardship that social distancing has required. But American businesses at every size and every means have come together to respond to the President's call. It really has been a whole of America approach. And our message from the President's White House Coronavirus Task Force is to tell the American people it's working. We're getting there. We can see light at the end of the tunnel. We can see the day that we can reopen and put America back to work. But it's going to take all of us continuing to make the sacrifices necessary to practice those disciplines to get us to a place where we can reopen safely and confidently. With that, Mr. President, I'll call Dr. Fauci up for his reflections, and we'll move on.
And there, folks, in my opinion, are the greatest vice president and the greatest president we've had since Harry Truman and Alvin Barkley. Leaders with godly principles.
But to kind of connect the dots from where we were, where we are now, and where I think we're going to be. So you remember a couple of weeks ago when we talked about the fact that we were going to have a really bad week because the deaths, particularly driven by the situation in New York, were going to get worse and worse. But yet, as that was happening, we were starting to see some turnaround, some flattening, and some coming down. As you've heard from Dr. Birx and will likely hear more, that is continuing. So what has happened is that the mitigation that we put in with the first 15 days and then the 30-day mitigation program of physical distancing worked. So it got us to where we are today. It is a successful formula. It is the basis for our being able to say that we can now think seriously about reopening America. And for that reason, we put together a carefully thought out and I believe well delineated and described program for opening up America again. And you know what it is. It's the guidelines that we announced a few days ago. Those very guidelines are based on a version of the successful formula that got us to where we are. So what I'm trying to say is that the program is not one that is going to be turn the lights on in America. We've finished. We're not. We have to proceed in a very careful, measured way. And if you look at the guidelines, they are careful and they are measured. There are certain checkpoints before you can even think about going into a phase one. And then things relax a little as you go into phase two, and relax a little and you go into phase three. Now, we live in a big country and it's heterogeneous, and there are different dynamics of outbreaks in different parts of the country. So the speed with which one can go from one to another, at the point at which you can even begin to think about the phase, is going to differ. So the one thing that I know, the urge we all have to get out there and get it over with, let's get back to normal, for a lot of good reasons, because there's a lot of suffering, economic and otherwise, in this country because of that. But again, as I pleaded early on weeks ago, I plead with the American public, with the governors, with the mayors, with the people with responsibility. Although I know one has the need to leapfrog over things, don't do that. Do it in a measured way. This is a successful formula. The problem is, if we don't do that, there is a likelihood that we'll have a rebound. And the one way not to reopen the economy is to have a rebound that we can't take care of. So please, again, let me just close by pleading with the American public in general and those who are responsible leaders to carefully consider how we get back to normal.
Amen.
Can you talk a little bit about your expectations for the fall? We heard from Dr. Redfield and Dr. Burks. What do you see for the fall? Is it going to be embers or possibly no return of the virus at all?
You know, as I've said before here, when you look at an outbreak, it's two dynamic forces opposing each other. If you leave the virus to its own devices, it will take off if you do nothing to stop it. If you put into place the kinds of things that we talk about, first containment, and then hopefully you never get to mitigation, but containment is important. Those two forces are going to determine whether you're going to have a big outbreak. So what Dr. Redfield was saying, first of all, is that we will have coronavirus in the fall. I am convinced of that because of the degree of transmissibility that it has, the global nature. What happens with that will depend on how we're able to contain it when it occurs. And what we're saying is that in the fall, we will be much, much better prepared to do the kind of containment compared to what happened to us this winter. Now, the complicating issue is that unlike the syndromic and influenza-like observances that we have, that you could pick it up by clinically what's happening, it's going to get complicated by an influenza season. And I believe that's what Dr. Redfield was saying, that it is going to be complicated. So whether or not it's going to be big or small is going to depend on our response. And that's what I think people sometimes have misunderstanding. Nobody can predict what is going to happen with an outbreak, but you can predict how you're going to respond to it. And that's really very important.
So you would caution against people thinking that in the fall there's not going to be coronavirus anymore and we won't have to worry about it.
No.
If it is, it'll be spotty and it won't be a big problem to worry about.
There will be coronavirus in the fall. If we do, which we won't, but let's take an imaginary period. We say, okay, coronavirus, forget about it. We're not going to do anything about it. It will take off. That's what viruses do. But that's not what's going to happen. We are going to respond to it to not allow it to do that.
Dr. Fauci, what happens when governors like Governor Kemp are not following this careful, measured plan and moving forward even without meeting the gating criteria?
Well, you know, if I were advising the governor, I would tell him that he should be careful
And I would advise him not to just turn the switch on and go, because there is a danger of a rebound. And I know there's the desire to move ahead quickly. That's a natural human nature, desire. But going ahead and leapfrogging into phases where you should not be, I would advise him as a health official and as a physician not to do that.
Okay? Go ahead, please.
Thank you, Mr. President. Can you please give some details about I know that the White House has just released a document. I haven't had a chance to
Well, we
review
can talk
it.
about that later. It's an executive order on immigration. We want Americans to have the jobs. We want Americans to have the health care. We want to take care of our citizens first. We have to. It's a very powerful order. It's for 60 days. At the end of 60 days, or maybe even during 60 days, I'll extend it or not, and I'll maybe change it. I might modify it. Yes?
Are we trying to change for immigrants who are already here, Mr. President?
Yeah, go ahead, please.
Immigrants who are already here in the country, or immigrants abroad who already effectively have a green card trying to get into the country and help their
We're
workers?
talking about immigrants that are trying to get in, and we're talking about people, and also, by the way, people that are coming in illegally. Now, as you know, because you've seen the numbers, our border, our southern border, is very, very tight. It hasn't been this tight in years. It's being helped by 160 more than that miles of wall that are going up. I'm trying to get to 450 by the end of the year, 450 miles. And we'll have 530 miles early next year. And that's really great. It's fully funded. We have all the funds, and the Army Corps of Engineers is doing a fantastic job. Same people that did Javits Center, as you know. They're doing a fantastic job. So our southern border is very, very tight, for good reason, for very good reason. We're also being helped by 27,000 very good soldiers from Mexico, and I want to thank the President of Mexico. He's been terrific in many ways, including on what we're doing with COVID. And as you know, we have a very good trade arrangement with Mexico now, which we didn't have before. So I want to thank the President of Mexico, in particular for the 27,000 soldiers. They're doing a fantastic job.
For healthcare workers, sir? You want to talk about exemptions for healthcare
Yeah, we
workers?
want to protect our healthcare workers, and that's one of the other reasons we're doing this. Yes, John?
Mr. President, I wanted to ask you about Rick Bright. He's the head of the federal agency in charge of getting a vaccine out to Americans once it's ready. He says he has been pushed out of his job because he raised questions about hydroxychloroquine and some of your directives on that. Was he pushed out of that
I
job?
never heard of him. You just mentioned the name. I never heard of him. When did this happen?
This happened today.
Well, I never heard of him. If the guy says he was pushed out of a job, maybe he was, maybe he wasn't. You'd have to hear the other side. I don't know who he is. Please.
And on the
Hold on
hydroxychloroquine
one
question.
second.
Well, I just wondered, you said by 4th of July, you expect people will be on the National Mall and we'll be having a celebration like we did last year. Given that the doctors are just saying that, coronavirus is still going to be out there, it might not be as bad as it is now, but it's still going to be circulating. Is that going to be safe to have that many people in the mall?
We're going to probably have 25% of what we had last year. Last year, as you know, was maxed out. I saw a magnificent picture of Dr. Martin Luther King. And I saw a magnificent picture of our event last year, and both of them were maxed out. It was beautiful to see, beautiful, very similar. This year, most likely, we'll be standing 6 feet apart. We'll have to do that in a very, very interesting way, and maybe we'll even do it greater. So we'll leave a little extra distance, but if we do that, we'd certainly do that. I don't see maybe the purpose if we can't do that. We have to have people, thousands. We had tens of thousands, most of you were there, tens of thousands of people this year. It was incredible. And it was, to an extent, an air show of all the different aircraft flying over. We even had Air Force One flying over. So ideally, it would be wonderful if we could actually have it as it was last year, and eventually we will have that. I think it's important to know, eventually we are going to have that. Your stadiums are going to be the way they've been for the last 100 years. No, I know, but your stadiums, as an example, sports, going to be the way they used to be. I mean, I told one of the owners, he said, do you think I should take out seats? I said, no, you shouldn't take out seats. We're going to have it the way it was. We're going to be back. This virus will eventually be gone. And if it should show up in the fall, we're going to put it out very fast. We have great people. We're going to put it out very fast because we've learned a lot. We've learned a lot about how to deal with this, and we'll put it out very fast. Yeah, please. Just nice and easy.
We talk a lot about testing capacity, and governors agree that that exists, but it's very different from testing implementation. And they are still begging for you to use your full authority to help them get reagents and other things. As you would like to say, what do you have to lose by helping them do that and becoming the king of testing?
And let me just say, we are the king of testing already. There's no country in the world that's done more. Not even
0.2% of the population has been tested. Is that good enough?
I just said there's no country in the world that's done more. And we have tests that have already come out that are going to be introduced very shortly that will do it more. My problem is this, it's very much of a media trap. Whether we did 2%, 5%, 50% or 100%, it'll never be enough, no matter what. Now with the expertise and with what we did because of our expertise and tremendous talent at manufacturing, what we did with the ventilators, that wasn't a trap because we got them done shockingly to everybody because of the incredible talent like Mike Pence saw yesterday in Wisconsin. But we have numerous of those sites all over the country doing the same thing. So that when the governors were complaining, some of the governors, I must say, and it was very much along party lines for the most part, but except for one, when the governors were complaining, we said, no, how many do you need? We need 50, we need 100. One governor asked for many, many, many thousands, and it turned out they didn't need that, and that's good. We got them, and nobody that needed a ventilator, you know this, and we went through this with the governors, that needed a ventilator didn't get a ventilator. That was an incredible achievement. With testing, it's a little different. It's much easier than ventilators. It's like 2%. But, for instance, the swabs are coming in by the millions. They're coming in, literally coming in by the millions. Totally ordered. We wanted the highest quality. We could have gotten a much lesser quality. We didn't want to do that. We got the highest quality. But testing, it's like, no matter how well you do, you can always say more. With the ventilators, they either have them or they don't. In fact, we went to one meeting, who wants a ventilator? One governor said, we'd like 25. 25, you got them. Who else? Nobody spoke up. That was 4 weeks ago. So that was great. The problem with the testing is, as I said, if we test 350 million people, you'll say, oh, we want them to have a second test or a third test or a fourth test. Not everybody believes as strongly as some people on testing. Some people want to do testing because they think it's impossible for us to fulfill that goal. That's easy compared to ventilators, as I've said. But we have a tremendous testing capability, better than anybody in the world right now. And every day it's growing, and it's growing very substantially. These doctors are very talented people. They've seen testing all their lives. They've never seen anything like we've been able to do. So we're going to give everybody what they want with the testing. But again, testing, and I've said it from the beginning, the actual test has to be administered locally. You can't do from Washington or faraway locations federal testing nearly as well as you can where you have a governor and he has mayors and they have representatives and they know the back of a Walmart. Put it in the parking lot in the back of a Walmart, or put it in a certain location in different states. They're doing it beautifully. It's working beautifully. The relationship I have with the governors, and Mike has, and we all have with the governors, I would say other than one or two, but even them, they don't complain. They're not complaining. So we're doing tremendous testing, and ultimately we're doing more testing, I think, than probably any of the governors even want. Okay, please, Jennifer.
Back on the immigration EO, can you say, is it just for green cards, for green card holders, or
Green cards will,
is it open for people
subject-
seeking temporary work visas?
It's subject to change. We have some people coming in, for instance, helping the farmers. We want to have the farmers take care. They've been coming for years and years, and they're helping our farmers, and they've been coming in for years. We don't want to do, the border's been turned off a number of times over the years. And you know what happened? Our farmers all went out of business. They were out of business. They couldn't farm. We're taking care of our farmers. Nobody ever took care of farmers like I take care of farmers. Including the $19 billion that we're dispersing to farmers because of some very good things that happened.
Subject to change because some of your advisors are saying there could be a problem with it, or subject to change?
No,
because
just
you want
it
to
might be
understand?
modified. It could be modified next week, in 2 weeks. It could be modified in 2 months. No, we may modify it as we go along. But right now we have a very powerful immigration ban, but it could be modified, meaning made tougher or made That's tough. We don't want to hurt our businesses, and we don't want to hurt our farmers. Very important.
Can I ask you about your conversation with Governor Kemp? What did he say to you when you said you strongly disagreed with him? And for gym owners and tattoo parlor artists and barbers in Atlanta and Georgia generally, would you advise them to listen to you and not to their governor?
Look, I'd like them to listen to their governors, all of their governors. I have the right to do if I wanted to clamp it down, but I have respect for our governors. They know what they're doing. I think, and as you know, Brian Kemp, governor of Georgia, I worked very hard for his election. He beat their superstar. He beat the superstar of their party. I think you could say I helped a lot. Michelle Obama, Barack Obama, Oprah Winfrey, they all went in. They campaigned for him very, very hard. And he lost. He also was way down in a primary and ended up winning a primary after I came out and endorsed him. So a lot of good things, and there's a lot of good feeling between myself and Brian Kemp. I like him a lot. I happen to disagree with him only in time and timing. I disagree. When you have spas, beauty parlors, and I love these people. I know the people from spas and beauty parlors, tattoo parlors, bikers for Trump, a lot of tattoos. I love them. I love these people. And barbershops. These are great people. But you know what? Maybe you wait a little bit longer till you get into a phase 2. So do I agree with him? No. But I respect him, and I will let him make his decision. Would I do that? No. I'd keep him a little longer. I want to protect people's lives. But I'm going to let him make his decision. But I told him I totally disagree. Okay.
Thanks, Mr. President. The Vice President in his remarks was talking about the federal efforts that have been undertaken as it relates to nursing facilities. And as you both know, they've been just so incredibly hard hit, just tragic. Over 10,000 COVID-19 deaths so far. The industry says that they're struggling as it relates to testing. Can you commit to increasing testing at the nursing facilities?
Yeah, well, we're doing that automatically. I mean, that's almost common sense, but we're doing that automatically. I mean, you look at the state of Washington, that was our first glimpse of it. They got hit so horribly in that nursing home. It seemed like everybody was from a particular nursing home. So we knew immediately that was going to be a problem, and we're doing that 100%. We're taking very special care of our nursing homes and our seniors, other than me. Other than me. Nobody wants to take care of me. But other than me, we're taking care of our seniors.
Another area. Thank you, Mr. President.
No, it's just an enormously important question. And we want to thank the American people who have been putting off visits to their grandmothers and grandfathers and moms and dads. It's tough. I'm going to be in Indiana next week, and I'm not going to go see my mom. She lives in her own home, but people get it, that the risk of serious illness for a healthy American of the coronavirus is fairly low. You'll either have flu-like symptoms or no symptoms at all. But as we've said so many times at this podium, and the American people get it, a healthy American could inadvertently convey the coronavirus to a senior with an underlying health condition and have the kind of heartbreaking results that we've seen in nursing homes around the country. It's the reason why from early on, the president took decisive action to raise the infectious disease standards at every nursing home in America. He deployed all 8,000 of our inspectors, the Center for Medicare and Medicaid Services, to dedicate all of their time to ensuring compliance with those new higher standards. We've spoken about nursing home issues with governors around the country, and frankly, there are governors around the country that have done remarkable work with nursing homes. You mentioned Governor Brian Kemp. He actually used the National Guard in Georgia. He deployed them to nursing homes to do cleaning and to disinfect areas of those nursing homes, and it's tremendous service. But to your point about testing, if you look carefully at the guidelines, Open Up America again, you will see that in phase 1, the level of testing that we contemplate is first that we want to be able to test anyone who has the symptoms that may be coronavirus and be able to test them quickly. Secondly, we want to do the kind of contact tracing, and Dr. Redfield and his team are deploying CDC teams in every state in America to be able to find out everyone that that person has been in contact with and test them. But if you look right underneath that, What we're directing states to do is be prepared to deploy testing resources first and foremost to nursing homes and long-term care facilities so that we can monitor any potential outbreak of the coronavirus among the most vulnerable population. Thanks to the leadership of our Surgeon General, as the President announced today, we're also going to be deploying testing resources to vulnerable communities, to underserved communities. The CDC released new preliminary data on the impact, particularly on African American communities in this country, and it's the reason why part of our phase 1 recommendation is that we deploy testing resources into those communities that are described by the doctors as socially vulnerable. Even as we speak, we'll announce next week that we're already in the process of deploying testing. And so it's a good opportunity to remind every American to be especially careful around our seniors, to heed the guidance about avoiding visitations, to protect the health of those who are most vulnerable. But the American people can be assured that from phase 1 forward, all the way through phase 3 and reopening, we're going to be helping to guide the states to focus on the most vulnerable, beginning with our seniors with serious underlying health conditions.
Praise the Lord, and pass the ammunition of godly principles.